You're going to start looking at your bones. Don't worry if you have, but like I said, in my experience for this school, I teach at the SPS, PCC and Pierce College. It used to be that Clover Park, the students just don't like to learn. But now, there's a different group of students that I just keep getting from this school, and they really are working very hard. But if in case you don't do well in your histology, don't worry, don't panic, right? If you have asked, I hope you can ask around for feedback on some of the students. Some of them they even get 60 in the first lab exam, but then when they go to the second and the third, anyway, they end up getting a very good grade. They don't have to repeat. I know you want your goal is A, or solid A minus, but some people, even if they end up with a B or a B plus, they're happy. At least they don't have to repeat. And that's always the case with students, as long as they don't give up. That's the thing. When you start getting angry, or just being resentful of the class, that's the beginning of your downfall. So you just don't give up. That's it, right? You don't do that. So, chapter 7 is about your bones, your skeleton. I have this articulated skeleton, and you have the list of structures that I want you to study. On the worksheet, the list of not that one. This one will come out in your lecture test, right? For the lecture test, there will be a picture of the skeleton like this. And for the lecture test, you should already know the big bones. For the lab test, you have in your worksheet, right here, the bones of the skeleton. That's the one that, those different structures there, the different markings there, that's the one that will be tested for the lab test, okay? But this one in the lecture test, I hope you don't forget, or I hope you don't mistake the two. So let's review. The whole thing is your skull. And this one here is your cranium, and these are your facial bones. Your cranium is made up of several bones, okay? So you have here the frontal, the parietal, temporal, occipital, and then inside you have your ethmoid and then the sphenoid bone. And we're going to look at them. That one you're supposed to know, you should know, for the lab exam. But for the lecture test, cranial and facial bones. The different facial bones, there's several of them, right? You have your maxilla, which is it's referred to as the keystone bone, because this one articulates with every other bone of the skull, okay? So that's why it's like the ankle. And then there's your zygomatic bone, the big bone right here, right? Your cheekbones. Then you have your mandible. Then every part, look at this one right here. Just look at your skull. It is like a hanger, isn't it? Look at your bony markings. Sometimes, or you should also know your bony markings, right? Like here, your cheekbones. You should know what's responsible for the nice position of your cheeks. Isn't that the part that you do for putting on the blush on, right? The cheekbone. So know these bony markings. Even right here in the back, you have this external protuberance, right here, external occipital protuberance. My husband always likes to, because he's in the army, he's always shaving his head. And I think it looks like the bulldog. Is it the bulldog? So I think it's so funny. But you see, that's where your skin hangs. It's a hanger. So it serves as a protection for your brain, plus a hanger for your skin, because your skin is your main external barrier, right? Physical barrier against possible infection. Okay, so you should know all these bony markings, there is your mastoid process, and this is a process of the temporal bone. So all of these processes that you see, there's a reason for them. Then you should be familiar with the word fissure or foramen. So in your book on chapter 6, there's the surface markings. So the way to study your bones for your lab exam number 2 is first know the different bones, and then go to table 6.1, the bony markings. So you should be familiar. What is a tuberosity? Let's say crest, trochanter, a line, tubercle, an epicondyle, facet, all of those. And then once you're familiar with those terms, at least be familiar. What is a tubercle? Oh, that's some sort of a bump. So when you look at the bone, you look for the bump. And that's what will help you identify the different structures that I want you to identify for your lab exam number 2. Okay?
What's you said 6?
Table 6.1. Chapter 6. Table 6.1. Table 6. Table, not a figure. Oh, table. Okay, table. Yes. No. We're going here. This is for the lab exam. Okay? For Monday, what did I say? Just cranium, facial bone, right? And then what's this one? This is your vertebrae. So, but you need to know for Mondays: cervical, thoracic, lumbar, and sacral. Okay? These bones are your irregular bones for the lab exam. It's very easy to identify which one is a cervical, which one is thoracic, which one is lumbar, and which one is a sacral. Of course, this one, the sacrum, very easy, right? This is very easy. It's just how do you differentiate between this, and this. You will look at the spinous process. This is a process, right? And that's the spinous process. The cervical vertebra, they have a bifid, meaning it's forked. It's like a tail with tooth. It looks like a fish. So the process of any cervical vertebra will look like that. It's not nice. So there's your cervical vertebrae, and there's the process. And it's always bifid. It's called bifid. You have it in your book. It's showing you. So it must be also in your. So look at figure 7.20. Oh no, table 7.2, the vertebrae. So it's showing you the difference between cervical, thoracic, and lumbar. You see the cervical, the bifid spinous process. The thoracic, if you look at this skeleton right here, I know the thoracic because look at the spinous process, it's pointing down. Whereas the spinous process of my lumbar is pointing directly. Okay? In addition, of course, the spinous process of my cervical vertebrae is small. The body is small. Whereas when you get to the lumbar, it gets bigger. Right? Which of the cervical vertebrae you think is most commonly affected by degenerative or old age diseases? Or
The lumbar.
Problems is lumbar because that bears your weight. Okay? I like to ask those kinds of questions. Okay? So there is by the way, if I'm asking for if it is the cervical vertebrae on the table that I'm asking you to label for lab exam. If it's C1, you should tell me C1. If it's just a typical cervical vertebrae, you just write cervical. You're not required to know which is T1, T2, I'm not requiring you to know that, but I'm requiring you to know C1 and C2. If that's what I have on the table, you should say C1 or you should say C2 because they both look so different from the rest of the cervical vertebrae. Okay? C1 is the atlas and C2 is the axis. If you look at your book, look at how C1 looks like. It's on page 221, figure 7.20. Look at this. I'm going to get the bones of the vertebrae. Okay. In the lab exam, I'm just going to have them, like that, and then you tell me what it is. So so this one, you see, look at the spinous process going down, thoracic. Look at this one. This is lumbar, right? Look at the difference. Just look at the body. This is bigger than this one. And then I'm going to show you another one. This one, look at. Can you see the bifid process? This is cervical. See the bifid process? That's a cervical vertebrae. But I'm showing you, look at, this is so different. It doesn't have a process like the other. So this is your C1. So if this is the one that's on the table, you're not just going to write cervical, you're going to write C1.
But if it's the other
But if it's this one, you just write cervical. That's good. You just write thoracic. You don't have to tell me the letter. You just have to write lumbar. And my favorite always follow-up question will be, of this one, which do you think is the one that is most affected by degenerative problems and why? You should know very easily. Or maybe I'll ask you, which of these bones is part of the thoracic cavity, something or whatever, you know? I like to ask, and then look at C2. Oh, there's my C2. So look at, this is the only one. This is the only cervical vertebrae that has that axis. This one with C1 makes it possible for us to nod our head or shake, right? That is the axis. Okay? So if this is
C1 and C2 have
there is. So maybe I'll just have that one there. So the correct answer is C. Then for the vertebrae, also you should know the curvatures of the vertebrae, right? The normal curvatures, the primary, and the secondary. The primary curvature means you are born with it. And if you remember, when the baby is born, it's already curved like that. So we are born with our thoracic and our sacral curvature. So this curvature right here and this curvature right here is already present at birth. Okay? And then, by 4 months, we're able to lift our head. That's a secondary curvature. So cervical is a secondary curvature. Then the last one to form is your lumbar. When you start walking, so you start having a butt, right? So this is the lumbar curvature. So those are the normal curvatures. You should also be familiar with with the abnormal ones. Yes, you have scoliosis, lordosis, kyphosis. So figure 7.21 is showing you the normal curves, right? And then the abnormal curves, scoliosis, Lordosis, right here, kyphosis, figure 7.17, abnormal spinal curvatures. You see that? Okay? Then 7.16 is the normal curves. Next, we go to the ribs. So as far as the ribs are concerned, you see the true ribs. The true ribs, they're called true ribs because they all articulate with the sternum. This, from rib number 7 to 12, they're called false ribs. Some books will start with 8, but look at the reason why they're called false is because they don't actually directly articulate with the sternum. They articulate with each other, right? And then this one, 11 and 12, is referred to as floating. They're just floating because they're just, this is not articulating with the sternum at all, okay? And then finally, you have the sternum. Please know the different markings there. The sternum, and this is again for your lab exam. But for your lecture test, right, if I just pointed here, you just write ribs. You don't need to write true ribs. The false ribs, floating ribs, that will be for your lab exam. Plus the different tubercles that you see here, that's for lab exam. Okay? And you see, every rib has two articulations, right? Anteriorly, it articulates with the sternum, and posteriorly, it articulates with your vertebrae, the thoracic vertebrae. And that's why the facets, right here, a flattened surface is called a facet. So the facets in your thoracic vertebrae are called articular facets because they articulate right here. See, a facet is a flat surface. So you know that this is where the rib articulates with the vertebrae. Okay, articular facet. And you'll be familiar with that when you're done with your, I know all your minds are on the upcoming histology test. Okay? Then, so look at this one. Sternum, ribs, and thoracic vertebrae, they form your thoracic cage or thoracic cavity, right? And of which there are two, the pericardial and the pleural cavity. I have always asked this in the lab exam, and I don't know why students always struggle with that part. They see the rib or they see the vertebrae, and I just ask leading questions that lead to this one. They answer cranial cavity. I don't know why they will think a different cavity where the answer is very obvious. And also, I think it is unbelievable how some people will answer correctly thoracic cavity. And then my next question will be, give me one organ that's found in this cavity. They write liver, they write bladder, they write brain. I don't know what they're thinking. They get it correct, but then they identify organs that are not located there. I was thinking when I was making the test, I shake my head because I'm thinking, I thought that was a freebie, that was an easy question. Because it's so obvious, what other cavity can be covered by the ribs? So, what I would always ask is this one, right? This is what I would always ask you to identify. Oh yeah, I think that's the mistake. That's the reason they make a mistake. If you identify the thoracic cavity as being the thoracic vertebrae as being the lumbar vertebrae, then that's when you start making a mistake. So be sure you know exactly which one is which. Because then my next question will be, what cavity does this form a part of? And you'll say thoracic. So then I'll say, what bone directly articulates with this one? You will say ribs. Then my next question, what other bone then articulates with the bone that you just answered? To complete the cavity, you will write sternum. If you answer thoracic correctly. So I think that's where they make a mistake. They mistake this for lumbar, and then all the answers are wrong. Okay? So just train your eyes on the difference between that one. Okay? Also, you should know this. This is your intervertebral disc. I like to, for the intervertebral disc, of course, I always like to ask, give me the function, right? What do you think is the function of the intervertebral disc?
Cushion.
Yes, it's a cushion, right? To prevent for pain-free movement. And then also, I like to ask you, what is this one? This is your vertebral foramen. This is the vertebral foramen. But then in between, sometimes I'll have this one. So this is vertebral foramen. There's a foramen. A foramen is an opening. There's another foramen here. This is intervertebral foramen. Look at, there's in between intervertebral foramen. And I always like to ask, what is the predominant tissue type that occupies this one here? What is it? Nervous tissue. Isn't that your spinal cord? What predominant tissue type occupies this one? Nervous tissue again. There's your nerves. That's how they come out. You see, these are nerves. Okay? So that's how your bones protect your delicate nervous tissue because they don't divide anymore. Right? Okay. So those are the bones of the actual skeleton. According to shape, what is the shape of your sternum? Flat. Okay. By the way, the sternum has three parts, right? The manubrium, the body, and the xiphoid process. Again, that is for lab exam. You're going to see them, the list, you're just going to mark it up. When for the first time you look at the list, it looks like it's overwhelming. But once you go through it, it's really not that much that I am asking. There's more to that. I just picked what I think is common. Please.
So if you actually pointed to the middle part, which is
The body.
if you just put sternum.
Oh yeah, in the lab exam,
Yeah.
if I just have a tape, there's a tape there and you just identify the bone itself. I'm going to tell you, identify the specific structure, then you identify the specific structure. But if it just says identify, you just give me the name of the bone.
For
Okay?
the lab exam, you want it to be specifically body upstream.
If I say identify the specific, then you be specific. If I just say identify, you just identify for the lab exam. Okay? Then, what's the basic tissue type of your intervertebral disc? Connective. If I make a smear of this one, if I make a slight preparation of your intervertebral disc, will I see osteocytes? What do you think? Yes or no?
No.
No, this is not bone, right? Only bone will have osteocytes. So, what do you think? Will this one, maybe I'll have you identify this as sternum. Maybe I'll ask you, will this have compact bone? Yes. Will this have spongy bone? Yes. Every bone has both compact and spongy bone components. Okay? And every bone articulates with another bone, except for the hyoid bone, which actually just anchors the bones that move your mouth for voice. Here. This is your hyoid bone. This is the. By the way, I have this on the table. Someone identified it as a rib. How can this be your rib?
A very small person. A very small person.
So this is not your ribs. You know, if it will help you maybe remember, just look at this
Very.
one. It has like the Dracula. So that's how I try to remember that it does not belong to my ribs. It is my hyoid bone. Okay?
It's what gets broken when you strangle somebody.
That's right. Okay, so then we go to the bones. Oh, by the way, in the skull, I always like to ask the fontanelles. The skull is made up of several bones. We just talked about that, right? But they articulate at the sutures. So you should know the different sutures. The lambdoid suture, the sagittal suture, okay? Coronals, all those sutures. And you have that in your list again. And when we're born, the bones of the cranium are not completely closed. So there's still some, the ossification is not completely finished when we're born, right? So we have those soft spots called fontanelles. That's the correct term, fontanelles. What is the function of fontanelles?
Allows the bones to grow.
Correct. It allows the bones to grow, and it also facilitates easy delivery of the baby, right? So it helps, it enables the head or the skull to squeeze and pass through the vaginal canal. So that's why it's very important for the fontanelles to be present. You have fontanelles until about 2.5 years old. That's when it's supposed to be fully closed. That's how they assess. If the fontanelles, if you're born with already a closed fontanelle, is that detrimental? Yes. There's a problem with growth of the brain. The brain has to develop. So I have an x-ray from a student of mine. She gave it to me. Her grandson has already synostosis fusion of the cranium when he was born. They didn't catch it. I don't know how they failed to catch that one. But they noticed at 1 year old, the baby was having, developmental milestones lagging behind. And so that's how they found out. So they did emergency procedure to open, let the brain grow. So far,
What is that called again when the brain is having to grow?
synostosis. Yes, it's fused. Okay, next we have your appendix. So this is actual skeleton. Now we have appendicular skeleton. So you have your upper limbs, right? You have, this is your clavicle. And you see there's two articulations to the clavicle, right? One is called ends, the sternal end, and this is the acromial end. So the sternal end articulates with the sternum. See? If you feel, you have you see your notch over there. This is called the sternal notch. But then you have this notch over here, the clavicular notch. So you feel right here, you feel the bump here. So I want you, when you're studying this one, because I like to give pop quizzes where I just flash or have pictures, PowerPoint pictures of different pictures of people with these things, bony protuberances showing. And I ask you what bone does that. Because you need to be familiar when you start practicing. A patient comes in with some abnormal things, you should be able to pinpoint which bone is affected. There it is. Just look at yourself, not the others. But I don't say that in a, look at yourself. See, look at, you feel your clavicle right. You feel this bump, this notch right here. I know this notch is from what? My sternum. Then I feel the bump over there. Oh, there's my clavicle. This is the sternal end of my clavicle. And it articulates with my sternum at the clavicular notch. Okay? So then there is, you go feel the other side of your shoulder right there. You feel it. There's a bump right here. So you feel that bump, it's right there. I always ask, do you think if you reach all the way right here, so you feel a bump right on top here, the bump on top, I know it's from my clavicle, right? But the bump over here now, you see, you feel the bump right here? That's not the clavicle anymore, you see? That's the scapula. See? And that's why, knowing your anatomy, someone comes in, they say maybe, I was trying to push open the door and it's painful now. Maybe there's a fracture. You think, thinking it must be the scapula. So you're going to look at the back of the individual. Maybe ask the patient to raise the shoulder. You'll see there will be asymmetry of the scapula. You look at the back, not the front, because you suspect scapular injury, not this one. So that one is down here. So you can tell. That's why I want you to train your eyes. Just look at yourself in the mirror when you go home, and you'll see that. And then you have a skeleton next to the mirror, and you just look at the different bones, and then you look at yourself. Just so you're familiar, also when you start practicing up here, okay? These ribs, you can see it when you look at yourself in the mirror, right? And there's muscles here. The function of the ribs is to lift up your thoracic ridge so that air can come in. So you see, that's why when you have a fractured rib, you have problems with breathing. Okay? That's how you study your bones. Then you have this is your scapula, of course, right? And there's the scapular spine. So this is the infraspinous fossa, the supraspinous fossa, and this is your infraspinous fossa. Okay? You should know which one is anterior and which one is posterior. So I like to have the scapula down here, and maybe I'll ask you. This is the subscapular fossa. So according to shape, this is flat. I just have the scapula right there on the table, and then I ask you. This I identify, you say the subscapular fossa, and maybe I'll ask you, this marking is in the anterior or posterior surface of this bone. It's in the anterior. This is posterior. Okay? Then you have your humerus or your shoulder bone, and then you should be familiar with the different tubercles, right? And here you have fossas right here. So there's the anterior part, and then there's the posterior part. You should know what articulates. So you feel over here. What's this one? Is this my humerus or not? It's not. That's the next bone. That is your ulna. So the ulna is unique because it has that, look at individual bones. So there's your humerus, and so here it is, and there's two fossas in there. And it's very easy which one is anterior, which one is posterior. The posterior has a deeper fossa. That's your olecranon fossa, which articulates with the ulna. So there is your So there's my ulna, there's my radius. The radius where the thumb is. So look at it. You can tell which one is ulna. So just by looking at three features, you can immediately identify which one is which. The radius has the flat surface. It's called the facet. So it's flat. It's obviously it's the radius, and this is the arm. Then you go down here, they have a styloid process. And that's what you see right here. Right? So one is the styloid process of the ulna, the other one is the styloid process of the radius. That's why you feel for the pulse. So you see, that's proof that the function of the skeletal system is a hammer. That's where everything hangs on to support and prevent us from falling down. Then we need to know the carpal bones. Okay? Here, just by looking at this one, if you feel those bumps, you feel this bump right here, you feel that bump, that is your pisiform. That's a carpal bone. Hear that? So, the pisiform bone, so those are your carpals. It's good, right? The carpals, the metacarpals, and then these are your phalanges. The proximal, the middle, and distal. But if you just wrote phalanges, that's good. Okay? Then you have your lower. So this is called the shoulder girdle. And then you have your lower limbs. You have your pelvis or os coxa. And the pelvis is made up of 3 bones, right? You have your ilium, you have your pubis, and your ischium, right? You sit on your ischium, your butt. The ilium is the one that your hands rest on. And you see, the ilium has 2 breasts. So when you go stand in front of the mirror, you can be naked, right? You feel the protrusion over there. That's the anterior, superior iliac spine, and then posteriorly there's another protrusion, anterior, inferior iliac spine. Okay? So they have to be there so that there's a place for my skin to hang, to anchor and hold on, support my limbs. There is this part here I used to always, it never failed, I always ask this part, identify. This is the acetabulum. Right? It's called and this is all 3 bones, the ilium, the ischium, and the pubis, they contribute to this depression. And this serves as articulation for the head of the femur. So this is your femur. Okay? And next, after the femur, you have your patella, which is a sesamoid bone, right? Then you have your tibia. So look at, with your tibia and your fibula. So look at, when you have your knee like this, you see that bump. You have your knee bent. Is this bump right here the patella or not? It's not. That is the tibia. The patella is on top right here. Okay, so that's what you feel when you tap the reflex hammer. That's where you tap, but not this bump. This bump I see. So you will have, after your histology, I'll have some PowerPoints. I just ask you, what do you think is the one that gives you that marking? You need to be familiar and like when sometimes you fall and you hit your hip right here. Do you think, what is it? Is it my pelvis? Oh, I'm thinking if you fell this way, it must be this way, right? Okay, it's the femur. So the greater trochanter and the lesser trochanter, it must be that one that's affected. Okay? Then you have your tarsals. So you should know. I love, as far as the tarsals are concerned, my favorite is this one because it's the obvious one, the big one, the calcaneus. And the one on top is the talus, okay? So calcaneus and talus. So this one right here. You should know how Because if you make a mistake that is like that, then you're gonna make a mistake. See, you should know that it normally it's like this. Okay? Sometimes I just put it like that, and then they answer it, I don't know why they. You just put it up like that. Okay? So this is your calcaneus or your heel bone. Right? And this is the talus. I like it. The rest are the cuneiforms. But these are my favorites. Huh? I will, but they're my favorite. The calcaneus and the talus. It depends, just so you know what are my favorites. And for this one, my favorite is the pisiform. The pisiform and the scapula. I like it. They're very nice. But you're going to know them by the time. Again, we only meet 2 days a week, so it's up to you to really spend time. If you want to get an A, you can, but you have to pour the effort and the time to learning your aim. Okay? Then, the next chapter, don't forget fractures. You will encounter fractures in the lecture test and the lab exam. There will be fractures. So remember how they form: endochondral ossification, intramembranous ossification. You should know your bone cells: osteoblast, osteoclast, osteocyte, and osteoprogenitor cells. Okay? Composition: collagen, the calcium salts. You need vitamin D, you need vitamin C when you fracture, you need protein in your diet for healing. I always like to ask why? That's how I try to find out if you know, you understand. Because your patients will ask you, why do you want me to take this? You should explain it. If you explain it to them, then they'll follow. That's it. Right? They will, and then they won't be a pain in your butt because they will keep calling you. Because they did, and something happened. But if you tell them, actually, they need to take care of themselves, they need to take their protein, water, etc. And that's why I ask you. That's why I always ask why. That's why I like follow-up questions, make it clear. And this is also preparing you when you get to Bio 242. There will be a lot of thinking, like to make you think. Okay? Which is preparing you when you get to the program. Wherever you take the program, it will prepare you. Okay? Next, chapter 8 talks about joints. As far as joints are concerned, there are several ways to classify joints. For me, don't forget, all bones joints are also referred to as articulations, right? That's why you have arthritis. They're also called arthrosis for articulations, okay? And there are several ways to classify joints. I just wanted to give you the functional classification of joints. If you look at the structural classification, it's just giving you the structure. We already know the structure. It's connective tissue, it is fibers, there is bone. So to me, it's more important for you to remember the functional classification. If you forget, just ask me. I always ask, what is the functional class? Maybe I'll ask in the lab exam, I'll ask maybe identify, I'll just ask you to identify whatever, and then identify this one. And then give the result, what we call the resulting joint. Now, for the joints, if you just write elbow joint, that's good enough for me. Because even if you go to China, elbow joint is elbow joint. Okay? So, that's okay. You can write temporomandibular joint or just mandibular joint. That's okay. Okay? Then my next question will always be, what is the functional classification of this joint? And the only correct answers are 3, either synarthrosis, amphiarthrosis or diarthrosis. This is depending on the movement possible in joints. So sin for one. Sin arthrosis are immovable joints. Like the joints of your skull, right? You can't move it. So again, give me the functional classification. It's either synarthrosis, amphiarthrosis, or diarthrosis. If you forget, just come and ask me. Sometimes you will forget, but I hope you know that this is the correct answer. Okay? Diarthrosis. Diarthrosis are the freely movable joints. It sounds like dynamic for me. That's how I try to remember. It's just very movable, it's very dynamic. And then amphi, it's like ambivalent. You don't know whether you're going to move or not. That's how I try to remember. So amphiarthrosis are just slightly movable. So there are some joints that's really movable. This one is movable, right? This one is amphi, slightly movable. Your uterus, right here. It's not completely movable. And then my next question will be, give me possible movements, or maybe I'll say flexion and extension are possible for this joint. True or false? So you should know the different movements. If you go to figure 8.6, there are the different movements. Of course, we're familiar with flexion, and even figure 8.5, figure 8.5 and figure 8.6. What is extension, flexion, hyperextension? You see. Then you have rotation, circumduction, adduction, abduction. And then here, figure 8.6, the special movements, the protraction, retraction, elevation, depression. Can you highlight those four? Protraction, retraction, elevation, and depression. Those movements are only possible with your jaw, your mandibular joint. You cannot say this is elevation, depression. This is flexion, extension. And I like to confuse students with that one. Maybe I'll say the elbow joint. Then maybe I'll say elevation and depression are possible for this joint. You will still say true. That's not true. The students will remember that elevation, depression is only for, that's how you open your mouth. When you open your mouth, that is depression. When you close your mouth, that is elevation. Okay? When you stick your mouth out, protraction. Pull it back in, retraction. Again, those two. In this picture, figure 8.6, letter E and letter E is only for what? For your jaw, mandibular jaw. Okay? And that's the end of, as far as your joints are concerned. That's all I want you to know for the joints. Okay? So are you required, even just go through these joints. You don't have to meet. It's really not, you don't necessarily, even if you just look at your bones, if you know your anatomy, where they are, if I ask you what is the resulting joint, you can say shoulder joint, because you know this is humerus and this is scapula, right? If you don't know it, then you're in trouble. You don't have to memorize the bones that make up the shoulder joint, hopefully. I'm hoping. Right. Right? You just need to remember what are the movements possible. Okay? Okay? And that's the end of your skeletal system. You're done. Then we start with the muscular system. We take a break. Break for 5 minutes.